This last story, it's our next guest, looking for a little pick-me-up for a very droopy problem. Check this one out.
Over the last 6 to 8 years, I started seeing drastic changes in my face. When I look in the mirror, I would see this person that was so much older than how I felt inside. And that bothered me. I noticed extra lines I never used to have. Cheekbones are dropping, eyebrows are dropping, bagginess around my eyes, the jowls, and my neck. I'm a master esthetician, and so I see the aging faces all of the time. But I was struck by how quickly and significantly my changes were happening. I take a lot of supplements, I take all of my fish oil, try to drink a lot of water, try to have reduced sodium in my diet. I use all professional products on my skin. I do facials, but they aren't correcting the issues. I don't want my picture taken anymore, and that used to never bother me at all. I really never thought I would be that person. I've been engaged for a while, and my fiance and I are planning to get married this summer, and I want a lot of pictures of that day for memory, and I want to look at that and say, wow, you looked your best that day. It would make me really happy if I could tighten things up, lift the features that I'm not having fun with anymore.
Andy is back in our procedure room with board-certified facial plastic surgeon, Dr. Keon Karimi. And he's going to be doing a new procedure called the Nova Lift. So Andy, first off, are you getting excited?
Very excited.
Dr. Keon, as you get things started here, explain to us what you're going to be doing.
Sure. So we're going to be doing the Nova Lift to non-surgically lift the jowls. So let me go ahead and demonstrate that. Come on back here, Andy. So these are dissolvable threads. I'll go into prep, please. To lift the jowls in a non-surgical fashion. So this is perfect for someone who either doesn't want surgery or is not quite ready for surgery. It can be done right in the office. She's not feeling anything, by the way, because she is numbed already. So we can just make a small little port there. The lower third, the jowls, are a very difficult area to treat in the office because, you know, up until now, all we had were fillers. And fillers can often lead to an over-volumized look, especially in this area. So I'm just coming right under the skin here. Are you okay there, Andy?
Just fine.
Wonderful. And this is usually painless. There's no downtime, and the results are instant. So it's very exciting.
And the key is, doctor, you're passing this thread that has little barbs on it, correct?
That's correct. So now this is out, and I've got this fixated now. So
Is that the thread?
That's the thread. And it's caught on the jowl now. And so we just literally...
Cut it flush with the skin.
And that's one thread there. And that's really the basis of the procedure. We're going to put a couple of more to really get a nice lifting result there. So
well, we're going to let you finish that up. We're excited to see the results, which we will show off a little later in the show. Are you all excited? I know I am. Let's see what's coming up next.